Best case, maybe 5 million if programs are partially restored. Worst case, over 10 million if further systems collapse. Other ripple effects include a reversal of 2 decades of public health progress, destabilization in 30-plus countries, and rising civil unrest where US aid once sustained hope.
Welcome to Clarity AI News, where we use advanced synthetic intelligence to identify and analyze news stories that matter most to people who truly care about independent media and honest, unbiased world news coverage. Please remember to like and subscribe below, and thank you for watching.
Hello. Today's update is serious, I'm afraid, but it's not sensational. Just numbers, just a very sad new truth for the world we share together. Nearly 9 million preventable deaths are now projected between 2024 and 2028 as a direct result of policy changes enacted under President Donald Trump's second term. Let's break that down. First, here in the United States, new legislation known as the One Big Beautiful Bill rolls back Medicaid coverage, disability access, and public health infrastructure. Researchers from Yale and the University of Pennsylvania estimate these domestic changes will lead to approximately 157,000 excess deaths, mostly from untreated illness, delayed care, and lost addiction services. That's about 52,000 lives lost every year, starting in 2026. But the global impact is even more staggering. Humanitarian aid programs like USAID, PEPFAR, and the President's Malaria Initiative are being shut down. According to projections from The Lancet, this will result in more than 14 million deaths by 2030. Over just the next 4 years, that's around 8.7 million lives, mostly in developing countries, lost to preventable diseases, famine, and the collapse of local health systems. Of those, roughly 700,000 each year will be children under 5. Why it matters? Because these aren't vague political abstractions. They're operational facts, measurable decisions with human costs. For the poor and working class in the US, this means no safety net, no Medicaid, fewer food benefits, more bankruptcies from medical bills. For the middle class, it means higher insurance premiums, overloaded hospitals, and no rural options. The wealthy are largely insulated. Globally, the poorest countries face the return of mass child death, untreated HIV, and preventable malaria outbreaks. Most likely outcome, around 8.86 million additional deaths by the end of 2028. Best case, maybe 5 million if programs are partially restored. Worst case, over 10 million if further systems collapse. Other ripple effects include a reversal of 2 decades of public health progress, destabilization in 30-plus countries, and rising civil unrest where US aid once sustained hope. To be clear, this isn't about blaming or dramatizing, it's about clarity. Policies aren't just words, they're levers, and this time they're pulling entire populations toward the edge. And clarity means knowing that every data point in this story represents someone who could have lived. That's the cost. That's the news.
Like and subscribe for more Clarity AI news stories in your feed, and comment down below with the kind of stories you'd like to see us analyze and cover. Although we use AI in our process, the people behind that process are very human. We read and respond to all comments. Thank you for tuning in and have a good day.